In this video, we're focusing on the Mastoids and internal auditory meatus series, reviewing CPT codes, standard radiographic views, and a brief overview of the new technology that has replaced these codes to help you confidently assign the correct codes. There are three primary CPT codes used in mastoid and internal auditory canal imaging. 70120, radiologic examination, mastoids, less than 3 views per side. This typically includes 1 to 2 images of each mastoid process. 70130, radiologic examination, mastoids, complete, minimum of 3 views per side, used when 3 or more views of each mastoid process are obtained. 70134, radiologic examination, internal auditory meatus, complete. This involves multiple views of the petrous temporal bones to assess the internal auditory canals and related structures. Always review the documentation to determine the number of views and whether the internal auditory meatus is the focus. Several specialized projections are used in mastoid and IAM imaging. These include mastoid submentovertex view SMV Schuler's method, Leicholm, apiaxial view, axiolateral oblique, temporal bone axiolateral Stenvers view, modified Stenvers view, paramastoid axiolateral oblique Arcelin method, styloid processes axial Cahoon method. While traditional X-ray views of the mastoids and internal auditory canals, like those we covered, do have corresponding CPT codes and may occasionally be ordered, it's important to recognize that these exams are now used far less frequently in modern practice. CT and MRI are the gold standard imaging modalities for evaluating the mastoid processes, petrous temporal bones, and internal auditory canals. They provide far superior anatomical detail and are typically preferred for diagnosing conditions such as mastoiditis, cholesteatoma, acoustic neuromas, or temporal bone fractures. However, as medical coders, we still need to understand these historical or less common exams, especially when reviewing older records, working in ear, nose, and throat or neurology practices, or coding for institutions with limited imaging resources. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content.